Welcome to the Deep Dive. This is where we take the sources you share with us and, well, we dig in deep to pull out the key insights and knowledge nuggets for you.
That's right.
Today, we're delving into some really crucial current affairs. We'll try to break down some complex ideas, highlight the issues that genuinely matter for understanding the world right now. We're looking at critical updates across public health, election processes, environmental challenges, and human development in India, all straight from the material you've provided.
And there are definitely some surprising connections and maybe some aha moments waiting.
Absolutely. Okay, let's unpack this first one. We're starting with something, well, absolutely fundamental to any democracy, the integrity of the electoral rolls.
The bedrock, really.
Exactly. And your sources highlight a really fascinating but also quite concerning situation unfolding in Bihar. Now, for anyone listening who might be less familiar, can you quickly define electoral rolls? Why are they so critical?
Sure. So, simply put, electoral rolls are the official lists of everyone who's eligible to vote.
Yeah.
They get updated periodically, or they should, to make sure they're accurate.
Right.
And that accuracy is vital. It's the absolute foundation for fair elections. If the list is wrong, the election can't be truly fair.
Makes sense.
And what's happening in Bihar involves this thing called a Special Intensive Revision, or SIR. Think of it as a really focused, intense effort by the Election Commission to update and verify these rolls.
Okay.
Now, the core issue highlighted in your sources is this. Over 11% of estimated electors in Bihar submitted forms during this SR. Now, that sounds like good engagement, doesn't it?
Yeah, you'd think so.
But the process itself has been, well, plagued by quite a bit of confusion. Initially, the chief electoral officer there in Bihar, they allowed some flexibility, leniency, really in document submission. People could register even if they didn't have all the, I think it's 11, normally required documents. But then the chief election commissioner stepped in and issued a completely contradictory directive.
Oh, okay. That sounds messy.
It is. The CEC mandated that all documents must be submitted by July 25th, 2025.
Yeah.
And then there's a strict claims and objections period right after August 1st to September 1st.
Right. So you've got the Election Commission of India, the ECI, that's the constitutional body running the show.
Correct.
And then you have the people on the ground, the electoral registration officers, EROs, and the booth-level officers, the BLOs. They're the field agents doing the actual work.
Precisely. They're the ones interacting with voters.
And it sounds like this conflicting guidance from the very top is creating just a massive headache, a ripple effect for them, and crucially for the voters themselves.
Exactly. And this isn't just, a small procedural glitch. The deeper issue, and your sources really hammer this home, is how these conflicting instructions from the ECI can seriously undermine public trust.
Yeah, I can see that.
Trust in these fundamental institutions.
Oh.
Ethically, if you think about it, when the system basically treats every potential voter as suspect until proven otherwise with a pile of documents,
Right.
it really goes against basic principles of justice and dignity, especially for poor and marginalized communities who often struggle the most to produce those specific documents.
So the very people you want to include.
Exactly. The irony is stark. An effort designed to clean the voter list could end up actually disenfranchising people. It's a paradox where good intentions, perhaps, clash with a potentially damaging outcome.
And that potentially violates the Universal Adult Franchise, Article 326.
That's the concern, yes. Article 326 guarantees that right. Now, there have been government interventions. Article 324 empowers the ECI. There's voluntary Aadhaar voter linking.
But voluntary is the key word there.
It is key. It's not mandatory. And this whole mess, this SIR process, has actually ended up in the Supreme Court. Petitions are being heard right now about its legality.
Wow. So, okay, the ECI is trying to standardize things now, maybe looking at alternative IDs. But is that really enough to fix the confusion that's already been caused, especially for people who might have just thrown their hands up and walked away?
That's a critical question. And it really brings up this tension, this balancing act, between ensuring the integrity of the roll and the absolute need for inclusiveness. You can't have one without the other, really.
So what's the path forward, according to the sources?
Well, several crucial steps are suggested. First, and maybe most importantly, the Election Commission has to standardize its instructions. Clear, consistent communication is non-negotiable.
Absolutely. Avoid the contradiction.
Exactly. Second, they need to broaden the list of acceptable ID proofs. Things like Aadhaar, ration cards, even MGN-REGA job cards. These are far more accessible for many people than that list of 11 specific documents.
Right, more realistic.
Much more realistic. Then there's a need for massive awareness campaigns, really get the word out, maybe use NGOs, local leaders to inform people properly.
Okay.
And finally, building in some kind of audit and accountability for the booth-level officers during verification. That helps prevent bias, ensures fairness, and crucially helps rebuild that trust we talked about.
Okay, that makes sense. Let's shift gears now. Moving from electoral integrity, let's pivot to another vital area, but maybe one that feels more immediately frightening: public health. Your sources bring us face to face with the ongoing fight against a really dangerous virus, Nipah. Now, I know this might be a new term for some listeners. Can you tell us about Nipah virus? Why is it such a major concern?
Absolutely. Nipah, or Nive, it's a very serious threat indeed. It's a zoonotic virus, which means it jumps from animals to humans.
Zoonotic, okay.
And in Nipah's case, the primary carriers are fruit bats. The really alarming thing is its high fatality rate, somewhere between 40% and a staggering 75%.
Wow, 40 to 75%.
Yes. So you can imagine the fear, the panic in a community when even a single case is confirmed, especially since there's currently no specific treatment or vaccine.
That must put incredible pressure on health workers.
Immense pressure, especially in Kerala, which has faced repeated outbreaks. This idea of diseases, jumping species, zoonotic spillover is why the One Health approach is so critical. Yeah, it's basically a collaborative strategy. It recognizes that human health, animal health, and environmental health are all interconnected. You have to tackle them together.
Got it.
Now, the specific news you shared highlights that just this month, July 2025, Kerala reported 2 Nipah cases. Tragically, 1 fatality, a teenage girl, and another woman in critical condition.
That's awful.
It is. And worryingly, over 425 contacts have been traced across 3 districts. The source of this specific infection, still under investigation. Containment measures are very much active.
And this isn't the first time for India, right?
Not at all. We saw it in West Bengal back in 2001, and then Kerala has had outbreaks in 2018, 2019, 2021, 2023, and now again in 2025. It's a recurring nightmare.
So Nipah is more than just a virus then. It sounds like it's also a stark ecological warning sign.
Precisely. That's a great way to put it.
Every outbreak seems to remind us that as we push further into natural habitats, clearing forests, we're not just displacing animals, we might actually be opening up pathways for these ancient threats to emerge.
That's the key insight, yes.
Yeah.
Our deep interconnectedness with the natural world. And the high mortality rate, plus the lack of treatments, understandably fuels immense public panic during outbreaks.
What are the biggest hurdles preventing us from getting ahead of Nipah?
Well, the challenges are significant. Climate change, deforestation. These are definitely increasing how often humans and animals come into close contact, raising those spillover risks.
Makes sense.
There's also, frankly, often weak coordination between different sectors: health, veterinary services, environmental agencies. They need to work much more closely together.
And the impact.
Huge impact. Public fear, obviously. Health workers face immense risks and burnout. And there's this desperate, urgent need for better early warning systems.
Are there government interventions happening?
Oh, yes. The Kerala Health Department, for instance, has become quite adept at rapid response containment zones, intensive contact tracing. ICMR, the Indian Council of Medical Research, and NIV, the National Institute of Virology, are crucial for testing. The National Center for Disease Control, NCDC, monitors the overall response. And India does have a Draft One Health framework from 2021. The goal is to build resilience against these zoonotic threats.
But the challenge is implementation.
Exactly. Implementing it comprehensively across all the different states and sectors, that's the real hurdle.
So, given how complex and interconnected this is, what specific steps are highlighted in the sources? How do we move beyond just reacting to outbreaks and start preventing them?
The way forward, according to your sources, really strongly advocates for a nationwide One Health program. Not just a draft framework, but a fully implemented program.
Right. Actionable.
Yes. Integrating data streams from animal husbandry, forest departments, public health, creating a truly comprehensive surveillance network. The goal is to spot risks before they become outbreaks.
Proactive, not reactive.
Precisely. It also means promoting widespread awareness campaigns, especially in areas where Nipah has occurred. Simple things like fruit hygiene, avoiding places bats might contaminate food.
Practical steps.
Very practical. Strengthening surveillance at local levels, maybe with mobile labs, rapid response teams, that's key. And, of course, accelerating research and development for vaccines and treatments is critical.
And you mentioned something about fruit.
Yes. Even simple measures like banning the sale of partially eaten fruits in local markets. It sounds small, but it could make a real difference in reducing exposure risk.
Fascinating. Okay, speaking of interconnectedness and the impacts of, well, our changing planet, let's shift to another crisis. This one's maybe more gradual, slower, but just as devastating. Climate-induced displacement.
Oh yes, a creeping crisis.
Exactly. We're not talking about sudden disasters like cyclones here necessarily. It's the slow onset effects. Sea level rise, saltwater intrusion contaminating farmland, coastal erosion destroying homes and habitats.
The slow violence of climate change.
Well put. And your sources paint a grim picture. Rising seas have already displaced coastal communities across India. Places like Satapaya in Odisha are often cited, but it's happening in Karnataka, Tamil Nadu, Gujarat, Kerala too.
It's widespread.
And what happens to these people, these climate migrants? Often they're pushed into precarious, exploitative, informal jobs in cities. They lack social safety nets, legal protections. It's a truly dire situation.
And what's really striking here, as your sources consistently point out, is the complete legal vacuum.
No specific law.
None.
Yeah.
There is no specific law in India that protects climate migrants, grants them rights, or outlines state responsibilities towards them. Despite this being a growing crisis affecting thousands, maybe millions eventually.
That's shocking.
It is. And adding insult to injury, large development projects, things under the Sagarmala Port Development Initiative or energy projects, tourism infrastructure, often end up worsening the ecological vulnerability of these same coastal communities.
Yes, sir.
By destroying mangroves, altering coastal ecosystems, increasing erosion, basically undermining the natural defenses these communities rely on. There's also heavy criticism of the Coastal Regulation Zone Notification, the CRZ rules from 2019.
Criticized for being?
For being too pro-industry, essentially. Diluting protections that existed previously, making it easier to build in sensitive coastal areas.
And this all ties back to fundamental rights.
Absolutely. Article 21 of the Constitution, the right to life and personal liberty, which the courts have interpreted to include the right to a healthy environment and a life with dignity. This should apply to climate-displaced persons.
But it's not being enforced effectively.
Not specifically for climate migrants, no. The issues are complex. Unregulated coastal development, yes, but also gendered impacts. Women often face the worst exploitation in informal city jobs. And enforcement of existing environmental and labor laws is generally weak.
What about the ethics?
Ethically, displacement without genuine consent and proper support is a profound violation of human rights. And when these communities protest, sometimes they face criminalization, which obviously infringes on their freedom of expression.
Are there any government frameworks trying to address this, even indirectly?
Well, things like the National Action Plan on Climate Change, NAPCC, and the State Action Plans, SAPCCs, do acknowledge climate vulnerability, but they tend to lack concrete roadmaps for rehabilitation and resettlement, specifically for climate migrants.
And existing laws like the Disaster Management Act.
They offer response-based solutions relief after a disaster hits. They aren't rights-based frameworks that empower displaced people with claims to resettlement, land, or livelihoods.
Even court interventions haven't fully solved it. You mentioned the MC Mehta case earlier.
Right. Landmark cases like MC Mehta were huge in linking environment to fundamental rights. But the challenge, as always, is implementation on the ground. Ensuring those principles translate into actual protection and support for climate migrants remains a huge gap.
This is clearly a massive governance failure, a huge challenge. How can we possibly ensure justice and dignity for communities literally losing their ground beneath them? What are the solutions proposed?
If we step back and look at the bigger picture, the way forward, according to these sources, is quite clear, although challenging to implement. First and foremost, India needs specific legal frameworks.
Laws recognizing climate migrants.
Exactly. Laws that explicitly recognize climate migrants, define their status, and grant them clear rights to resettlement, to livelihood support, to compensation perhaps. A formal legal status is crucial.
Okay, what else?
Fundamental reform of those CRZ rules we mentioned. Shifting the focus from enabling industry to genuinely prioritizing community-based conservation and the resilience of coastal populations.
Putting people and nature first.
Essentially, yes. And critically, ensuring free, prior, and informed consent FPIC for all coastal projects. Affected communities must have a real, meaningful say before projects that impact their lives and environments. Go ahead.
That sounds crucial, FPIC.
It's fundamental.
Yeah.
And finally, extending proper labor protections to these incredibly vulnerable workers once they are displaced to move into informal urban jobs. They need minimum wages, safe working conditions, Social Security basic rights.
Ensuring dignity doesn't end when they leave the coast.
Precisely. It's a continuum of rights.
Okay. For our final topic, let's turn to a critical indicator of human development, maternal health. Your sources dive deep into India's efforts to prevent maternal deaths. And there is some positive news here.
Yes, thankfully some progress.
So, maternal mortality ratio, MMR, that's defined as the number of maternal deaths per 100,000 live births. And a maternal death is one occurring during pregnancy or within 42 days of delivery from pregnancy-related causes.
Correct.
The good news is India's overall MMR has declined significantly, from 103 back in 2017-19 down to 93 in the 2019-21 period. That's definitely progress worth noting.
It is. A lot of effort has gone into that.
However, beneath that national average, there are still huge disparities between states. Kerala has an incredibly low MMR, just 20. Fantastic achievement.
Truly world-class in parts.
But then you have states like Madhya Pradesh at 175 and Assam at 167, among the highest. That gap is enormous.
It is stark. And understanding the why behind those numbers, those disparities, is really insightful. Your sources highlight the 3 delays model, which was conceptualized by Deborah Main.
The 3 delays model.
Yes. It perfectly explains the pathways to maternal death. First, there's a delay in recognizing danger signs during pregnancy or childbirth and deciding to seek care.
Okay, delay 1.
Second, there's a delay in actually reaching a suitable health facility. Think distance, transport, cost.
Delay 2. Access.
Right. And third, there's a delay in receiving adequate and appropriate care once the woman reaches the facility. Staff shortages, lack of equipment, lack of blood, delays in treatment.
Delay 3. Quality of care.
Exactly. And this model really shows why those disparities exist. It's particularly acute in the Empowered Action Group states, EAG, states like Bihar, MP, Uttar Pradesh.
Why there specifically?
They face chronic capacity issues. Your sources mention a shocking statistic: 66% specialist vacancies at community health centers, CHEs, in these states.
2/3 vacant. Wow.
Yes. Obstetricians, anesthetists, the very people needed for emergency care. And the common medical causes of death, postpartum hemorrhage, obstructed labor, hypertensive disorders, these often become fatal precisely because of those 3 delays, especially the third one.
And the broader impact.
Immense. Maternal deaths are largely preventable tragedies. They reflect deep inequities in the healthcare system and are a key indicator of state performance. They also devastate families, impact child survival, and hinder gender justice.
Ethically,
failing to provide life-saving maternal care when the means exist is a violation of the right to life under Article 21. And the stark inequities highlight structural injustices that need addressing.
Have interventions like the National Health Mission helped?
Oh, undoubtedly. The National Rural Health Mission, now NHM, launched in 2005. The Janani Suraksha Yojana, JSY, promoting institutional deliveries, the 108 ambulance service, these have all contributed to bringing the MMR down.
But there are still gaps.
Yes. Particularly the concept of fully functional first referral units, or FRUs. These are facilities meant to handle obstetric emergencies 204/7, but often they lack the staff, blood storage, or equipment to truly function as intended. They're under-implemented in many areas.
So it's encouraging to see the overall downward trend, but clearly these life and death challenges persist, especially in certain regions. What are the key strategies being highlighted to ensure every mother gets the care she needs, no matter where she lives?
If we connect this to the bigger picture of achieving equitable health care, the way forward really emphasizes strengthening those first referral units, the FRUs.
Making them truly functional.
Exactly. Ensuring they have reliable blood storage, the necessary surgical and anesthesia staff available around the clock, 247 services, not just a building with a sign.
Right.
Another key recommendation is replicating the Kerala model of confidential maternal death reviews across the country.
Confidential reviews, how does that help?
It creates a safe space to analyze why a death occurred, focusing on systemic failures, delays, lack of supplies, protocol issues, without assigning blame to individuals. This leads to genuine learning and system improvements.
Learning from mistakes without fear.
Precisely. Beyond that, promoting community-level education is vital. Using self-help groups, ASHO's workers, women's collectives to raise awareness about danger signs, birth preparedness.
Empowering women and families.
Yes. Also, early intervention for common problems like anemia during pregnancy, which is a major risk factor, and improving access to telemedicine, especially for consultations in remote areas, can bridge some of the distance gaps. It's about a comprehensive approach.
That makes a lot of sense. Well, as we wrap up this deep dive, it's just so clear how interconnected all these seemingly separate issues really are.
It really is striking, isn't it?
From the very foundation of democracy and voting systems, to the health of our environment impacting displacement, to the immediate crises of viruses like Nipah, and the fundamental right to safe childbirth.
Indeed. And perhaps this raises an important question for you, the listener, to think about. How do these challenges, whether they're sudden shocks like a virus or slow burns like rising seas, how do they ultimately test and maybe even shape the resilience and the accountability of our democratic institutions?
That's a powerful thought to leave with. We really hope this deep dive has given you not just information, but perhaps some new ways of thinking about these critical issues and spotting those connections.
Lovely, yes.
Thank you so much for joining us on this exploration of your sources. Until next time, keep digging, keep asking questions, and definitely keep connecting those dots.